But the disconnect is that there's this misconception that if someone's under, let's say, WIC or some type of assistance when it comes to the nutritional intake, that that's enough. But they miss the aspect of understanding that there's a science to understanding food. If I may have access to food stamps, maybe my first thought isn't buying healthier foods because maybe I don't know how to use or how to cook them or how to apply it in my daily diet. Maybe there's a disconnect with my culture. So it's a little bit different to incorporate what's being explained to me and expressed on how to have a healthy pregnancy. So within my fellowship and working with those two site preceptors, I was able to kind of be hands-on with creating this innovative approach and having women who are coming in, who are going for their screenings, to come in and get a little bit more education, understanding about gestational diabetes, understanding that, hey, did you know that there is a dietitian in your local ShopRite or local grocery store? You can take advantage of this, right? How to walk the aisles of a grocery store, right? Showing them in real time how to cook the food because we had opportunities to have chefs to come in. And that was also fulfilling because during the most sacred time of people's lives, which is bringing in new life, sometimes you have a lot of uncertainty and you're not too sure and you want to be the best mother you can be. You want to be your healthiest for your child and you want your child to be as healthy. But the way that the information was broken down and just ex- um, just expressed to the patients who were a part of that, you can tell that it left lasting like a lasting impression on them, to the point it's like, hey, my cousin's going to have a child, can she come, right? Can she be a part of this group, right? It's something that you want to be a part of, not necessarily a chore, right? And it didn't hurt that they were getting incentivized as well for some of the activities we have for them. For example, reading their receipt, right? Can you go to the hospital being more intentional purchasing healthier food? And let's go through it. Let's talk through it and taking it from there. So that was a very good experience. And it continued to spark, right, my interest in maternal child health. Later on, as you mentioned, I did do the Title V internship, or I should say fellowship, with the state, where I was a part of the Healthy Women's Healthy Family Initiative, or Nurture NJ, for those who are familiar with New Jersey and some of the different opportunities we have, but just touching on doula care. Now, prior to that, I didn't even know what a doula was, right? But I was introduced to midwifery because actually my first publication during my senior year in undergraduate was about traditional birth attendants, which kind of sparked the understanding of midwifery, and kind of just had me more like intrigued that support actually makes an impact when it comes to people's health, right? Whether it's you're at the doctor getting your hand held to get your shot, right? Or maybe just someone taking their time to answer your question. So you don't feel that you're alone and giving you that space. But to go back to the fellowship, it was a great opportunity to learn about the state and how they function, see the opportunities and the partnerships that they did have when it came to doula care, how they were very intentional of having doulas having a seat at the table, and just the connections I was able to make during my time at the state. I had the opportunity to have my site preceptor, Lolitha Johnson, and former Assistant Commissioner Lisa Sare, who I worked under her department when I was at the state. But it just kind of made you understand how we all work together, right? Health and the understanding of providing services is all interconnected, and you do need to know what services are out there to be able to make your best informed decisions for yourself, whether it's understanding SNAP, whether it's understanding that having social support can improve your outcomes when it comes to you being a birthing person, whether it be just having access, right? Medicaid reimbursement, having access to a breast pump through insurance, right? Sometimes people don't even know what they have access to, right? So those were really great opportunities that I'm glad I can share a little bit about.
Yeah, you were definitely keeping yourself busy, that's for sure.
Yes, I won't add on more, but we were definitely very busy, but definitely grateful for it.
Yeah, yeah, no need to add on more. But if anyone is interested in learning more about your journey, like definitely reach out to Kimberly and connect and ask all the further questions that I do not have time to ask today. But kind of, I want to kind of couple, I guess, two questions here. Like,
Yes.
what were some MPH takeaways, as well as how important were those various experiences that you had to, I guess, developing your skill set as a public health practitioner?
I would say don't run away from numbers. and I'm saying this for anyone who's ever taken biostats, right? Was not my favorite, right? But just having the basic understanding of not only qualitative but quantitative data as well is very helpful, because when you can understand how trends work, or if you're trying to have justification to the need of certain things, especially for myself, I do community work, so needs assessments are very helpful for understanding the capacity or seeing what needs to be done or the limitations that we can address. But I would say definitely don't shy away from courses if they may seem difficult. Be open to asking questions. I think it's this notion or this culture that when you get to graduate school, you're just kind of thrown in and you have to figure it out. But there are resources available. I went to a university where we're keeping the public in public health, right? And I love the slogan because the public starts with us too, right? We are bringing in what we see the needs of our own communities are, which is why we're going into a profession that's moving with intention to address them, right? And just understanding that.